Hi everyone, I want to hope that you're keeping safe and I want to trust that this finds you well. My name is Dr. Ayuya Mwaka of Daystar University. I'll be bringing to you an introduction to psychopathology. This introduction is part of the series of topics we're going to cover in this course. And just to give you a preview of what is expected after today's lesson is that we will be covering areas such as the overview of the DSM-5, the Diagnostic Statistical Manual of Mental Disorders. We'll be looking at the criteria for making diagnosis using the DSM-5. We'll be looking at the biopsychosocial cultural model in understanding psychopathology. We'll also be looking at very specific disorders such as anxiety disorders. We'll look at mood disorders. We'll look at somatoform disorders. We'll be looking at personal disorders, substance abuse related disorders, amongst many other disorders, including child and adolescent psychopathology. Now, as we'll be looking at that, we'll be looking at what they are, the criteria that is used to make such kind of a diagnosis, look at some of the causes, some of the impacts amongst many other areas of discussion. But to introduce us to that, it will be good for us just to look at an introduction. Probably by the end of this lesson, it is expected that you should be able to, be able to define various terms that can be used in psychopathology. You should be able to differentiate what we call abnormal and normal behavior. We should also be able to differentiate descriptive and dynamic psychopathology. You should be able to define general symptoms that define abnormal behavior, which you're going to call in this course the symptomology of abnormal behavior. Now, after that, we will now go to various aspects that I have earlier mentioned. Thank you and welcome. So let's first define some few terms in regards to psychopathology. Let me first define abnormal behavior. And I want to be cautious when defining this term, that this term is a very culturally defined term, because what is normal in my culture is not necessarily what is normal in your culture, depending on your social norms, depending on your social orientation, depending on your culture. So basically, we can define this as what deviates from what is considered as normal. See, it's very culturally defined. So it is that behavior that is inconsistent depending on the social norms. So if it's a one difficult term to say, you want to be using it because we are culturally different. Another culture defines abnormal behavior differently. If I smile, another culture might find that as abnormal. Another culture would find that as normal. If you don't smile, another culture would actually find that abnormal. So it's a very culturally defined term. Another word I want to look at is mental health. We can define mental health as optimum level of psychosocial functioning. When somebody is able to function psychosocially well, then we call that as good. We refer to that as person having a good state of mental health. However, the word mental health then leads us to understanding what mental illnesses are. And mental illness is simply some level of deviation from such state. And which state? The state of level or an optimum level of psychosocial functioning. So when someone has a psychosocial challenge, then that can be defined as a mental illness. But we don't want to use a mental illness as per se in the sense that it's a very sometimes stigmatizing word. People use it in a very stigmatizing way, and preferably using psychosocial challenge is a better term as opposed to saying someone is mentally ill or someone is having a mental illness. So preferably, I always say someone has a psychosocial challenge as opposed to saying someone has a mental illness because of the stigma that comes with that term. To define psychopathology, it would be good to understand what the word psych means and pathology means, because psychopathology is drawn from these two terms. Psych means the mind and pathology means disease, and therefore we can define psychopathology as behaviors or experiences that indicates the presence of a mental illness or a psychosocial challenge, even though we only refer to this after formal diagnosis. Now, we can define psychopathology as a scientific study of a normal state of the mind. And the abnormal state of the mind is when the mind has a certain challenge in terms of functioning. So it is sometimes referred to as a study of abnormal behavior. So psychopathology is going to help us understand mental illnesses or mental disorders, and that's where we want to go. Now, as we move to the next slide, I want to break this psychopathology into terms. Let's look at each of them. The first one is descriptive psychopathology. Now, basically, this is what you're able to, or what objectively the client experiences. And you can observe it as a counselor or a clinician. They can tell you about it. So you can describe. They can objectively let you know what it is all about that is happening in their mind, or whatever challenge they are going through that is affecting them. So basically, it's an objective description of the abnormal state of the mind as experienced by the client who comes to seek help, and you can actually sometimes observe part of it. For example, a client can tell you, I am having fatigue, I cannot sleep, I cannot be able to complete my assignments, I have lost interest. You can observe the client looks in terms of the appearance or behavior, maybe the dressing, maybe the mood. You can be able to observe and let all this. Now, what you can be able to observe, what the client can objectively let you know what they are going through, is called descriptive psychopathology. Now, we also have what we call dynamic psychopathology, and these are usually unconscious mental states of the clients. May not be easy to pick them. Sometimes you might have to carry out some certain tests to pick them. Some of them might actively be acted out by the client. For example, when you give them a picture to draw, maybe draw a house, draw a tree, there's certain things that you would have not picked or gathered had the client not told you, or not told you, because what they told you is descriptive. What you can pick that is unconscious, including certain behaviors, such as regression, such as projection, such as coming out from certain tests that you have given the client, for example, projective personality test, then that's what we call dynamic psychopathology, because this is the behavior that you are likely to gather unless you carry out a certain test or certain behavior is behaved so that you can pick it. So this describes psychopathology in two forms: descriptive and dynamic psychopathology. Now, let's look at what now then defines an abnormal behavior. Now, before looking at that, there are certain aspects or certain criteria that you can actually be able to define what abnormal behavior is vis-a-vis what is not. Or let's talk about whenever someone has a psychosocial challenge or a mental illness, then some certain specific aspects need to be met, or characteristics for you to actually look through as you go to undertake this criteria with the DSM-5. One, the intensity of that symptom or that underlying the client has given you. If a client talks about, for example, fatigue, how much is this fatigue? Persistency, how are they feeling frequently? How are they feeling this fatigue? How long has it been there? And other than fatigue, are there other symptoms that the client is presenting with? Because we can't just say the client has depression. No, we need to understand that it comes with certain groupings of certain symptoms. So intensity is the magnitude of that particular symptom or the symptoms presented by the client. Persistency is the frequency, the timings at which this symptom or symptoms are presented, and then the related symptoms that come with whatever the client is presenting with. So for descriptive psychopathology, look for that. You could also look for the time. How long has this? For psychopathology, let me use depression or major depressive illness that is commonly found in many setups. You find that a time course is for 2 weeks and above. A client presenting certain symptoms with certain intensity of those symptoms and persistency in certain time. So if it is like, for example, 2 weeks, we can actually group and say, because of these many symptoms plus ABCD, then the client has a certain condition. So for every condition, there is a timeline that we can. Just because I have a headache or just because I felt fatigue for the last 2 days does not qualify me for depression. One, it is only one symptom, so it can't qualify me. Two, the persistence, just 2 days, that can't qualify. Three, it is not with other symptoms. So there must be several things that you must look at before you qualify someone for a certain or diagnose someone with a certain disorder. There must be that intensity, the persistence, the syndrome, and then we talk about the time course, how long this condition has been existing or these groupings of symptoms have been existing. Finally, and not least, what constitutes the thoughts and the form of client's thoughts? In terms of thoughts, what is the form, what is the content, how is he presenting himself, how is he narrating the story, what is the understanding in terms of memory, concentration, amongst many others, what is it that the client is telling you? So basically, whenever you're looking for, what if a client gives you, for example, tells you, well, I have been having sleepless nights for the last two weeks, I've not been eating. I mean, it's important that as a clinician, you go deep to be able to find if there are other symptoms related to this, whatever the client has presented. Secondly, you also want to check whether how in the intensity of these symptoms, and you also want to check how long this client has been having these symptoms. One or two symptoms may not pass for any diagnosis, and therefore you must be able to look through these three areas for you to understand. So it is the clinician's responsibility to dig deep into the clients. Clients can just present with two symptoms and just say, for example, I have fatigue and I'm also feeling bored. That's not enough for you to make a criteria, or that's not enough for you to be able to make a diagnosis. Now, because of now what you're going to learn in class for various disorders, it is that ignites you to go and ask the client further questions regarding those symptoms. So we will be looking at this as we move on. Now, let's go back and now ask ourselves, so how is abnormal behavior defined? One, statistically, it is that is unusual and deviates from the average normal behavior. Now, this is now defining this from what differently from how we defined it earlier. Now, we are saying it deviates statistically. In other words, in this environment, another environment, we can all agree this is not usual of a person in terms of how they are presenting it. Secondly, it makes the client to not adapt appropriately in certain functioning. It hampers the client's ability to function within their social context. So if someone has, say, depression, or someone has, say, for example, specifically bipolar or depression or a personality disorder, amongst others, I'm just mentioning few of them, then this person, you find that they are not functioning appropriately because it is a condition that keeps disturbing. Thirdly, it is characterized by some degree of, distortion in the way they perceive things, in the way they feel, in the way they think. So it always affects these three areas of life: someone's way of feeling, someone's way of, thinking, and even perception or behavior. So generally, that is what is characterized by. Another way to look at abnormal behavior is that it is viewed as abnormal or unusual by the surrounding or the setting in which the person lives in. Now that takes us to our initial definition. So that is encompassed in that. And of course, we can now say, which is actually just like what we've said a little bit earlier, that it affects the way the person feels, thinks, acts, which becomes unusual. Now, this now brings in the aspect of stigma, where now when the person, when the behavior is defined as abnormal, you find that people are like to stigmatize this kind of a person because according to the people's view, subjective way of thinking, is these people are not behaving the way they want them to behave. Many people do not treat mental illness as just like every other condition, physical condition. And people label a lot of stigma on people with mental disorders. So this is what we can define as abnormal behavior. What is it that defines normal behavior? One, a person person behaves normally when they are able to possess efficient in terms of reality, in terms of how they perceive the reality. So in other words, they are aware of whatever is happening around them. They're aware of, the reality around them. Secondly, they have ability to be self-aware. When you already perceive your reality, then you are able to be aware of yourself and, of course, knowledge of yourself, some sense of self-worth or degree of self-worth and self-esteem. A normal person will have ability to exercise voluntary control. They have voluntary control over behavior. For example, um, someone can't just go and pee or, in a place they don't have to be peeing, for example, or somebody when they feel like they want to do something, they will control how they're doing it. So that is, if someone has schizophrenia, for example, they may not really have control over some behavior because it's not intentional, but it's a mental problem. So basically, people with normal behaviors have some ability to exercise voluntary behavior over their behaviors. They have ability to form efficient relationships. If you have schizophrenia, for example, it might be difficult to form some certain levels of schizophrenia might be difficult for you to be able to form efficient relationship. Even when you're very depressed, you may not find it very really necessary to form some relationships, especially when you're giving up on life and thinking this is not done and life is worthless, it's unworthy living, etc. And finally, and not least, not many people are productive. Doesn't mean that people with mental illness or abnormal are not productive. No, but it's normal for you to be productive. However, with a mental illness, there could be some challenges there. It doesn't mean that everybody goes through that. No, but there could be some challenges, as we say, that can affect the way you definitely become productive. Now, let's look at symptomology of psychopathology. And I just want to look at general symptoms that define psychopathology. It doesn't mean that every client presents with these symptoms, no. But they are just general in terms of the occurrences that are most people who present with psychopathology present with these symptoms. The first one is disorders of appearance. Let me more explain, because in subsequent topics we'll be looking at them in much detail, and for now we just want to define what they are. So when we talk about disorders of appearance, it has to do with the client's appearance. When the client first knocks your door to seek help, or even next session or the next session, how do they appear in terms of their body state, in terms of their health state, in terms of appearance, in terms of the way they're grooming, all that pertains appearance. Is there something that you can note and pick that you feel that this would actually contribute to helping you in terms of your diagnosis? Remember, mental state examination has to do with mostly observations, what we observe with the client, but the client doesn't tell us but what we observe. So you want to gather that. Another symptom has to do with behavior. Sometimes the clients come with various types of behaviors, agitation. Some of them movements are are in different forms. Some of them remain in the same state forever, like stupor. So you find that sometimes clients will present with symptoms around behavior. It is important that you gather and pick that. Others have to do with perceptions. For example, a lot of clients with very severe mental illness present with illusions and hallucinations. Illusion is a misinterpretation of a stimuli. For example, someone sees clouds and misinterprets that means the clouds are heavy and it's going to rain, and they misinterpret that means the president is going to die. Now, when we talk about an hallucination on the other side, an hallucination is a perception that does not really exist. So the client perceives what does not exist, even looking around. We perceive by our senses. For example, hear voices that are not existing, feel like things are crawling in the body, but there's nothing crawling. Maybe smelling something that is not being smelled by other people. May taste something and say it's very bitter, but everybody else knows that it's sugar, it's honey, it can't be bitter. So perceptions have to do with hallucinations and illusions. So these are some of the things you also have to pick and gather from a client. Disorders of thinking, the main one usually are delusions, and delusions are firm beliefs there's no evidence over those beliefs. For example, a belief such as that I am God, or I believe that I've been talking to the president on the phone, or I believe that I am ABCD. So there are beliefs And I know this is where matters of spirituality and others come in. How do you differentiate this as spiritual and this not? But I think as a clinician or a professional psychologist, this is something that you need to pick at a lesion. But others could come in terms of how they portray their way of thinking. For example, flight of ideas. You're gathering information or getting to know your client, but they keep moving from one statement to another, etc. Sometimes there's no cohesion. For example, in depression, you could ask someone something and they don't want to talk. That is poverty of thoughts, because they don't want to talk to you. They don't feel like talking. And there could be so many areas of thinking that you can be able to gather. Think about disorders of emotions as well. This is very key, because then it has to do with how the client feel. It has to do with the reality around them, the surrounding, etc., and emotions. So you also want to pick anything that would think otherwise affect the emotions. Very, very key. We also have disorders of body image. This is how the client portrays themselves and feel. Some people can even feel that I'm in a skin, I am feeling like I'm a frog, I'm feeling that. Some people even think that I am, in a different state of a body, etc., the way they portray themselves. This is something that you need to pick when you're gathering and picking information from a client. Others are to do with memory, and this is to do with attention and concentration. Sometimes, like for example, in depression, a client may just completely be out of, you're talking to them, but they are not concentrating. Schizophrenia, amongst many others. So basically, again, this is an area you want to also be very specific. Most of people with psychopathology, mental illness, portray with some of these disorders of consciousness. Has to do with memory, awareness. Are they aware of themselves? Are they aware of their surrounding? Are they aware of who they are? So, this depersonalization, dualization, you want to gather that and be able to help the client understand themselves. Depersonalization has to do with awareness of the reality of the surrounding. Depersonalization has to do with themselves, being aware of who they are. Finally, not determination of attention, concentration has to do with also memory, but again, it has to do with the span of understanding things, how long, and concentration, which we can actually also classify as disorders of memory. So this actually explains more on this area of symptomology of psychopathology. Now, let us look at a little bit of now dynamic psychopathology and look at other areas that you need to consider while taking care of your client. Remember, we said that in psychodynamic psychopathology, you may need to carry out some certain tests. Some of them may be between the behavior, but it's very unconscious. This is not something the client has told you. This is something that you can see unconsciously done, or during the test that you're giving, for example, personality tests such as a Rorschach or a personality test such as a thematic perception test. You can gather this so quickly, or draw a person tree house. You gather this very quickly in terms of symptomology. So let's look at now these areas of psychodynamic psychopathology. Remember that we are informed that much of dynamic psychopathology is informed also by the use of some mechanisms, psychosocial mechanisms, which we preferably look at them as defense mechanisms by Sigmund Freud, but they help us understand dynamic psychopathology. So let's now look at that. Now, let's look at, for example, justification of a problem, where a client will justify why they are in certain situations, why they behave in certain situations, amongst others. Repression, it's more of clients not wishing to remember what they have gone through. They try to push them into the unconscious mind because they do not want to bring them to the conscious state. Reaction formation, this is mutually unacceptable impulse, which is transferred to its opposite, so that when you are unhappy something, you look like you're so happy about it. Denial, you don't want to even talk about, the client doesn't want to talk about it. It's like nothing happened. For example, my child did not die. No, he's living or he's sleeping. He'll wake up someday, but then the child is dead. Projection, a client is able to use their own feeling and wishes to attribute to another person. For example, you feel that you could, you don't like about the other person, something about the other person, but you tell them you like about it, and that's actually, or the other person feels that about you when they don't feel that about you. So that's projection. Regression, you go back to immature behaviors. Probably this is an adult, you just find they're driving a toy, and that's actually regression. And finally, one of the most positive mental unconscious mechanism is actually sublimation, where you find a client trying to use, convert energy into something very positive and something that is very socially acceptable. So this is what we call dynamic psychopathology, and it's more of now defining some of the aspects that you may not be able to pick in the client. Some of them can come through tests. Some of them you may be able to see as you are taking your clinical interview or interrogating the client or having a discussion with the client. They come out unconsciously. And this is what we call dynamic psychopathology. So basically, it brings us to the end of the introduction. And we have been able to define some terms that helps us understand psychopathology, including abnormal behavior, mental health, mental illness, and psychopathology. We've looked broadly at two types of psychopathology, descriptive and dynamic psychopathology. And we've been able to now to look at each separately by looking first of all at what do you look for when you're looking at descriptive psychopathology. And we also have been able to mention what abnormal behavior is, what normal behavior is, and looked at various symptomologies of psychopathology. And finally, we've looked at dynamic psychopathology. I hope this gives you a preview of what psychopathology is. As next topic, we're looking at more of the DSM-5, the overview of the DSM-5, as well as the criteria of making a diagnosis. Thank you, and I hope to see you again. Remember to keep watching for more topics in this area, as this is just an introduction. So bye for now and take care of yourself.